Good evening. My clock says it's 5:30 in the east, so I will call to order this meeting of the Knox County EMS Medical Services Cost Review Board. My name is Richie Beeler. I'm representing the Knox County Clerk's Office for the purpose of facilitating the beginning of this meeting so that this body can elect a chair and then get about the business of what it is tasked with doing. So we'll begin by calling the roll. By the way, if you want to speak, just pull these mics down. They're always hot, and if you want to mute them, just push the button. So I'll call the roll first. Mr. Valentine?
Rick Valentine, present.
Mr. Phillips?
Here.
Ms. Livers?
Present.
Chairwoman Durrett?
Here.
Mr. Dabbs?
Here.
Let the record show all members are present. So at this time, I will read the purpose of the committee, and then we will elect a chair, and once we've done that, the chair can handle the rest of the agenda, establishing the quorum and so forth. The EMS Medical Services Cost Review Board is established for the purpose of reviewing any discretionary increase in service or equipment costs covered under the county's ambulance services contract and proposed by the county's selected ambulance service contractor. The board shall consist of 5 members recommended by the county executive and approved by the county commission. 2 members of the board shall be active professional members of the EMS industry, but shall not be employees, officers, or agents of the county's ambulance service contractor. 1 member shall be a person with professional experience in healthcare finance. 1 member shall be a member of the county commission, and 1 member shall be a citizen representative who shall not be associated with the EMS industry or have any immediate family members who are associated with the EMS industry. The terms for service on the board shall be 4 years. No person shall be eligible to serve more than 2 consecutive terms on the board. For the initial appointment of the board, 1 EMS representative is designated by the commission, and the citizen representative shall serve a term of 2 years, which shall not count against them for the purposes of the term limit provision in this section. The term of the county commission representative shall run concurrently with his or her term of office. At its first meeting, the board shall select a chairman and vice chairman who shall serve in said roles for 1 year, subject to re-election at the annual September meeting of the board. It shall be the duty of the board to meet at least once annually in September to select a chair and vice chair and to conduct any other business the board deems necessary and appropriate. It shall further be the duty of the board to meet at any time the county's ambulance services contractor proposes an increase in the price of equipment or services allowed under the contract. Any proposed increase in prices by the ambulance services contractor shall be submitted in writing to the chairman of the board, who shall be responsible for calling the board into session to consider the proposed price increase. The board, in its sole discretion, may call public hearings to get citizen input on proposed price increases. The board shall act upon any proposed increase within 60 days of the contractor's submission of the proposed increase to the chairman of the board in writing. Any action of the board shall require the positive vote of a majority of the membership of the board. So we will proceed now with the election of a chair, and we will take nominations for chair, and once those have ceased, if more than 1 person has been nominated, we will poll the body and vote until someone receives a majority. If only 1 person is nominated, then we can entertain a motion to elect that person by acclamation. So I'll now open the floor for nominations for chair. Mr. Dabbs.
I nominate Rick Valentine.
Mr. Dabbs nominates Mr. Valentine. Are there any other nominations?
I move to cease nominations and vote by approve by acclamation.
I have a motion to cease nominations and elect Mr. Valentine by acclamation. That motion by Chairwoman Durrett. Is there a second?
Second.
Second by Mr. Dabbs. All in favor?
Can I second my nomination? Okay.
It doesn't require it, so yeah. Second by Mr. Dabbs. All those in favor, please say aye.
Aye.
Any opposed? Congratulations, Mr. Valentine. You are the chair. The meeting is yours, sir. I believe you need to elect a vice chair, and have a great meeting, everybody. Thank you.
Thank you, sir. Dr. Dabbs, remind me on that Christmas card there when it comes there
Oh, yeah.
at the end of the year. Welcome, board members. Welcome to our guests. And it has been determined that we have a quorum, so I guess our next order of business would be to select a vice chair. And at this time, I would accept nominations from the board for the position of vice chair.
I'll help you out, Mr. Valentine. I'll nominate Dr. Dabbs.
We have a nomination for Dr. Dabbs as vice chair.
I move the nominations cease.
We have a motion that nominations cease. Is there a second?
Second.
All in favor of nominations ceasing, please say aye.
Aye.
And the ayes have it. Dr. Dabbs, you're now elected vice chair of this committee.
Thank you very much.
And so we have a chair and a vice chair. We have established a quorum. And so our next item on the agenda is to actually set the agenda. Is there any other agenda items from the committee members that need to be added to the agenda at this time? Seeing or hearing none, we'll move forward with a review of the proposal by AMR. And unless there's an objection from the board, we will invite AMR to the podium for their proposal and statement of the proposal that we have in front of us. AMR, you're now recognized.
Thank you, Mr. Chair. Josh Spencer with AMR Regional Director. Several months ago, I guess this is the first time we've ever done this that I'm aware of. So several months ago, I'd emailed Mr. Parton and Mr. Van de Veit that, you know, there's been obviously, I think as everyone knows, substantial changes in our world. The last time we reviewed our costs. And so there's a simple 2-page letter, I think it's in your packet, which basically outlines our request for changing our current usual and customary rates. I do think it's important to note, and obviously some of you that are in the EMS industry understand this, but I want to just highlight that this does not change for Medicare or Medicaid patients. They're charged a flat rate that's governed by the state and the federal government. So this is only applicable to either commercial insurance or private pay residents who use our system. So the other thing I just wanted to highlight is obviously I think everyone here knows that AMR is non-subsidized, so there's no tax base, there's no money coming into the AMR from the county. So the only collections that we have are what's actually collected. It's a fee for service system. So how we kind of came up with the numbers, and I would certainly encourage and recommend you do your own homework on some of this, because as you may imagine, it's not always easy to get other surrounding counties to give you this information as a provider ourselves. We did do some research, and these are the numbers we came up with. And basically what we kind of decided to do, which we felt like was reasonable and fair, was take as many of the surrounding counties around Knox County that we could find, take their rates and propose the average of all those rates, exclusive of Knox County, obviously. So that's what's in the proposal before you, and I will certainly be happy to answer any questions that you may have, or if there's anything specifically you want to know.
Josh,
Board
quick,
I'm sorry, Dr. Dabbs. Board members, questions for AMR?
yeah, a question I had was just trying to find, you know, if I were looking at this, I'd try to find a like service somewhere in this size of city in terms of just the volume, and trying to kind of compare that with, you know, we talked about like Chattanooga, Greenville, South Carolina, you know, those kinds of places to kind of get an idea, because the increase is so, you know, high.
Sure.
You know, but again, you know, you guys have been living with fairly low rates for a long time, and surprised that you've not been able to, a lot of change has probably been going on with your industry as well in terms of trying to figure out, you know, what the right rate is. And, you know, we were surprised, like I would be surprised that there hasn't been a request for increase. So it doesn't look quite so high, you know, when we look at the rates now. So
Well, no, there's certainly some explanation for that. One is it's obviously quite a process to get the board together, and we were learning kind of how that looks, you know, during the middle of COVID and all the other things and you know, it just didn't feel like the right timing with all that was going on in our country, in our industry, in our community to ask for this until now. We're kind of on the back end of that, and we've certainly seen a our collections per transport has not changed hardly at all, maybe 1% in the last 3 years. And our charges have been relatively flat for a very long time now. To answer your earlier or I guess to make a point to your earlier comment, Dr. Dabbs, Mr. Parton did send me a note last night, and I did some research, and I did find, I think you may have some things in your packet. It's really difficult to compare apples to apples, right? Because while I think we can get close, if you're looking at municipal-based EMS services or services that itemize billing on top of their base rates, there's a whole lot of different variables to kind of consider. So one, and I'm not sure if you actually got this in your packet, but one that I did send yesterday evening I thought was as most relevant of an example as we could find, was our DeKalb County, Georgia operation. That's a non-subsidized system. It's a private EMS service, and that's AMR there. And I think their rates even were higher than what we proposed for this change. So that's the best I could kind of come up with. The state of Kentucky did do a legislative change a couple of years ago. Now every provider in the state of Kentucky has to post their rates. So I did provide that as well. And I'm not sure what would be the most feasible or most comparable county and service, but that was kind of on my research late yesterday evening that I sent that over. So.
One question I have, in doing your averages, because I didn't do the math, but typically in some instances when averages are done, they disregard the lowest and the highest. Was that done with these, or was it just straight across the board?
It was straight across the board, yes,
Okay,
sir.
thank you.
Mm-hmm.
I will reflect for the committee's information on this. Apparently, the data they have for Jefferson County is old, as our rates are higher than what are listed here. And I will be happy to share those with you if you want those.
Yeah, Mr. Phillips, if you would please share those, and then that would allow board members to put corrections on that, please.
Okay, so for Jefferson County, under that column for Jefferson County, our ALS emergency rate is currently 1,000. Our ALS non-emergency rate is 850. Our BLS emergency rate is 950. BLS non-emergency rate is also 850. And then our specialty care transport is $1,200. And we charge $15 a mile, so that's data that's probably a couple years old. We raised our rates about 2 years ago.
And Mr. Spencer, do you have any data that tells you at what time these numbers were collected?
Some they were across the board. I don't remember off the top of my head. I can go back and dig through my emails. As far as Jefferson County, I want to say that was 21 data that I had. I know Cott County was 22 data, and I only know that because that was public record in a solicitation for services there. And then the others were where I could just obtain, we could obtain based on our connections and relationships in the industry.
Yeah, I will add to what Dr. Dabbs was saying in the fact that I think that it would be beneficial for me to, and to not, don't get me wrong, I think it's beneficial to see what is surrounding in our region. But I think I would also like to see data from Hamilton County, Davidson County, and Shelby County as well, just kind of looking at the other big three areas there, and just kind of, I know that there's a difference in populations in that, but certainly any time that there's some things that are compared, it usually ends up with the big four here across our state. So I think that I would like to see that.
I was, obviously I didn't, the extent of my research last night was Google searching, trying to find any public documents on some of that. So I have not, gotten too involved in Hamilton and I guess Shelby and Davidson County. But I do know all three of those counties are for the 911 services, especially as you know, Mr. Valentine, are municipal-based services. So again, there may be a difference, but I'm happy to do the research. I just did not have time to do it, after the ask.
Yep.
I'm not sure, maybe it may be easier for this body to ask for that than for me as a provider. to
Yeah, I
ask
was
for
going to
that.
recommend, maybe Melinda or someone with the health department could maybe be the one that does the outreach on that. And I think that they may even have a better means of access to that
Sure.
as well as we move forward. Board members, any further questions for Mr. Spencer?
Yeah, just in terms of just you talking about itemized after a certain amount. So, these are kind of global fees, and I'm not really sure exactly how you guys,
Yeah.
charge those things.
Yeah, so in our contract that we have, I think it was required that we have bundled billing services, meaning everything is all rolled up into one. So it's basically your base rate for the type of service plus mileage. Some counties, other areas do additional charges, like even the DeKalb, Georgia one you can see here, where there's a special charge for oxygen, I think, and the EKG monitor and things of that nature. And so again, this is what we charge. It certainly doesn't mean it's what we collect.
Sure.
I think across the industry right now, that we are seeing in my region about 35% of actually billed charges we collect for, and with our averages being around $800 a trip right here in Knoxville. So it's pretty low. But to that point, and obviously these guys who are living this day to day with us could help certainly prove this. But for example, an IO needle, which is, as you know, Dr. Dabbs is a way of administering medications when you can't get an IV. Those are about $110 a piece. In a bundled billing system, if we have to use an IO needle or administer Narcan, which is very expensive, our charges doesn't change. We can't charge the consumer for needing that product or that type of medicine, and it really certainly strains, and I think that dilutes kind of the actual revenue per trip sometimes as well. So I hope that answered your question.
Yeah.
I apologize if I
Yeah, it
rambled a
does.
bit.
So basically, if I'm in a cardiac arrest and you guys come work on me, and that's an ALS emergency, regardless of what happens to me and how many times you shock me and give me meds, et cetera, get me to the hospital, and you're charging me $1,300. No, not 13. It's
I think
$1,000, about $1,000.
that sounds 800 plus mileage, depending on where you live. Yeah.
And commercial pay varies because I don't
Correct.
know if you guys have, being an emergency physician, we have contracts with every insurer, and their negotiated rate is
Yes, they are.
about 60% of maybe that $1,000, and Medicaid's about 50% of that, and Medicaid's about 20% of that. No pay is none of that.
Correct.
And I assume you collect essentially zero on your no pays. About we have 5%.
That's correct.
And we do certain assessment of the payer's ability to pay, and then what Team Health does, we write the bill off because if they're not, there's no reason to carry them to collections. I assume y'all do the same thing.
Same.
It's like this is not, you can't squeeze much out of this person, and so even if they owe $1,000, we just write that off.
Yeah. So very similar process. I
Our
can tell you
collection rate is very similar to yours. It's
very,
about
very similar.
35% all.
Correct.
all across the
And to your point on the commercial insurance, don't believe we're in network here with Blue Cross or anybody, but a lot of these commercial insurances, they obviously, to your point, they give you a negotiated rate, and sometimes it's so low it's not even worth going in network with. So that's true. And I can tell you too, just some rough numbers that, speaking of your write-offs, our write-offs in Knox County it's almost an 8-digit number every year. So it's way up there.
Well,
That's
I
just
can speak
uncollected.
for the committee. I don't know if I can. I don't know them that well. I don't know. I've just met Courtney, and Dottie, but I think our goal is for you guys to be able to bill and collect enough for you to make your profit and for you to pay your workers enough, and you guys are probably struggling, as I know, because I go to the EMS Region 2 meeting every month. And I know that they're struggling to get people to staff their ambulances, and it's tough. And I know that's the same thing with you guys. And I know the service is not where you want it to be right now, because I talked to all of my physicians in every ER, and, you know, you guys are struggling to meet your goals to keep you guys from being penalized and to, you know, to get people from point A to point B. And I don't know how you're doing it, but our goal is for you guys to, whatever that cost is, to be able to recruit good people and keep good people, you know, and provide a good service for all of us.
Sure.
Because sooner or later, all of our families are probably going to need
I hope you never do.
your kind of service. You know, it's, you know.
I will say that we have done in the last couple of years, and some of you may know this, we've made a pretty aggressive wage adjustment to make us more competitive for the same reasons. It's trying to get the workforce is just difficult.
Yeah.
Lots of things that we do to try, we sponsor our employees to go to school, to scholarships and paramedic school and things of that nature. We've changed the rates, but the collections obviously hasn't changed to catch up with it, which has put us, you know, pretty substantially behind the curve right now, which is the reason why we're meeting today.
I think that you just answered the majority of what this question would be, but I, in turn, just like Dr. Dabbs, I think it's something that this board needs to hear is that, do you have a plan in place for this additional revenue? If it were to, you know, this additional stream of revenue that comes in, and how would that be tied to the level of service you're now currently providing and what you're hoping to do in the future?
You know, it's, I think the short answer to the question is, personally, I hadn't really got to that point. I know we're in the middle of an RFP process, and we hope we're the provider here still 7 months later. But right now, we are operating at a substantial deficit. So anything that we could obtain that moves us back towards being in the black is the goal. But right now, every year, we are operating at a major deficit. And that's because, obviously, the cost of doing business has skyrocketed. As I mentioned, the uncollected, you know, the unbillable or uncollected trips that we do, among many other things. But the short answer to your question, Mr. Valentine, would be anything we collect right now just to get us back to break even would be fantastic, if that somewhat of an answer.
I have a follow-up question. You mentioned these costs are for, proposed costs are for private pay and insurance, is that correct?
Correct.
So what percentage of your service delivery falls into that? Like how many of the private pay and ambulance, or private pay and insurance? If you'd had to do like
You happen to know
50%,
that off the top of your head?
like ballpark?
I mean, this is a guess. Probably 35% of our total transports. I'm totally guessing, but I will get factual information and email it to the group.
I can give you from our standpoint, and I bet
It's very
that
similar.
the utilization for emergency medicine is probably similar to what you guys have to run. And for our Medicare and Medicaid, Medicaid is about 20 to 25% for a TennCare, and Medicare is about 30%. And then insurance, commercial pay, is probably another 30% or so, 25%. And then the uninsured or private pay is somewhere between 15 and 20%. And it's always been kind of a quarter, in a sense. It kind of off and on. And, you know, TennCare hit, and it certainly increased the number of patients that were covered. We would like to see that our TennCare expanded so that another 10% of our population would be covered, but right now that's not. That's another issue. But and one of my issues too is just how do you guys do insurance? So if I've got Blue Cross Blue Shield and you're out of network, you know, we're out of network because Blue Cross Blue Shield kicked us out of network, and they're reducing our payments by 20%. So because we can't surprise bill anymore. Right. We can't turn around and bill the patient any longer. We can't do that because that's against the law. Now, I don't know about, probably it does not necessarily do the same with you guys, but if you're charging me $1,000, if you're charging the insurance $1,000 and they've got a pre-approved rate, we're going to pay you $400 for that. You know, how do you go, can you go get that other 600? Do you bill a patient and they're
We do,
responsible?
we do balance bill on
Okay.
their patient responsible portion. But everyone, as you know, everyone's benefit package looks different. So, but we can and do, balance bill commercial insurance, private pay, things of that nature. And we also have a pretty aggressive kind of compassionate care program where if we can't get, if they can't make, we'll set up payment plans and do all those things with anyone just to try to collect as much as possible. But yeah, to answer your question, we do balance bill third party and private insurance and personal or no insurance.
Josh, tell me, and I don't know, tell me the difference between AMR and GMR now? Is AMR is a subdivision of GMR?
That's correct. GMR, Global Medical Response, is the parent company of American Medical Response, Lifeguard Ambulance in this community, Rural Metro Fire. So they are the umbrella, if you will, of those organizations. We have, and again, just a quick high level, additional. We're in about all 50 states in some way, shape, or form, whether that's a helicopter, a fixed wing ambulance, or wheelchair service or something of that nature. But yeah, that's the short version. Is GMR is the parent company of AMR. AMR and AMGH merged. AMGH, Air Medical Group Holdings, merged in 2018, I believe it was, and that's when GMR was formed.
My question revolves around potential gains. So your annual call volume for this, your transport volume for this market? Do you have that number?
I do. We are seeing around, looks like this year we're trending to be around 45,000 total transports.
45,000 transports annually?
That's
Correct.
within the city?
Knox County, all of Knox
All
County.
county, okay.
The overwhelming majority of that 45,000, I would say probably close to 95% is 911 calls. The interfacility non-emergent stuff, the Lifeguard brand of GMR handles most of that now, or other providers in the county.
Right. Okay. Have you done an analysis and have an anticipated, we're doing this to solve a problem.
Sure.
And so have you done an analysis to estimate what your gains would be or how much it would help your organization in raising these rates to these proposed levels?
I don't have an exact number off the top of my head. Our finance team did send that to me. I'd be premature if I suggested anything, but I would say probably, again, I can confirm this, but probably in the neighborhood of $100,000 a month that we would see an improvement on our net revenue.
Sure. Obviously, nope, you can't.
Yeah.
You're ballparking it.
And
but-
it's based on the theory of obviously the history, right? We're collecting this percent of what we actually bill.
Yeah, more than likely, your percentage of collection is not going to increase, but,
But the cost, yeah, the average of the net would increase. Correct.
okay, thank you.
Board members, further questions for Mr. Spencer?
Just a couple other comments, and from my side, I'm just trying to think, it's really not our role to talk about performance. That's what that's what always kind of hits to me, is I just want to make sure that we have the level of performance. That's not what we're here for. This is not a performance review, it's a cost review. And I hope the downside effect is that the county, they're the ones that
Benefit.
put all those performance indicators in the contract, right? And I remember doing that back in 2000. God, it seemed like, was it 2000? When was it? When the last
I
contract
think
was?
13 was when.
13. It seemed like it was longer than that. But and the goal was just set the bar. You guys say we can do that. Knowing that there's penalties, which you guys wanted to meet those things. But even though if there are penalties, if the service is not where it needs to be, then, the penalties are not really effective. And I think, you know, again, I think I know all of us in the room, the goal is for you guys to make enough money, you know, to be successful, and to be able to perform at the level where there are we don't have to assess those penalties. But that's not a feature that y'all have to worry about, but you've got enough to where you're able to, you know, hire the best and brightest, you know, EMTs around and get that work done. Again, unfortunately, that's not what we dictate. Right? We can't really say that. We just hope that the county contract, you know, is able to, whatever that RFP is out to you guys,
Right.
and that we hope that you guys bid on that. Again, a lot of my friends are great paramedics and have been for 40-something years, and I've ridden a lot of rides with you guys. You know, most of them are retired now, except for me. You know, it has been a great service, and you usually have some great people leading the group. So I guess, again, that's just kind of lamenting the issue of performance versus cost. We hope that they mesh up, because if we don't approve these, again, knowing a little bit how corporations work and how companies work, and, you know, you can't continue to do a very good service or service at all unless you're able to, you know, collect money, you know, reasonable money to keep the wheels turning, no matter what you do.
Yeah,
So-
and I just want to add to your point, agreed, yes, and thank you for that comment. I do agree with you. Unlike many other businesses, pick a hot dog stand just for a weird scenario, you can raise the cost of what you charge the consumer, and you will collect what you charge from the consumer based on the way the market operates, right? Unfortunately, in to your point earlier of the percentage of Medicare and Medicaid, you're going to get what you get, and you can't balance bill, and so the issue, the problem is somebody else has to kind of carry the rest of that weight, right? And as the cost of doing business continue to rise, the hot dogs and the buns, to use that analogy, the revenue for doing the business, and I'm sure these two guys would certainly shake their head in agreement, remains flat, or in some cases goes the other direction, and that gap continues to widen, and that's what puts anybody doing business, whether it's a hot dog stand or an EMS agency, in jeopardy.
Mr. Spencer, I have a question.
Sure.
I know the county is in process of renegotiating our contract and accepting RFPs, and we're in that RFP process right now. Does this rate increase if you were in fact to remain the provider for the county, what effect, if any, would this rate increase have on that?
Initially, I would say no effect, because we don't know what the RFP is going to look like. So it's really hard to say. If this becomes our new usual and customary rate, depending on how the RFP is written, that may be our charges in it. It may look a little different, but I think one of the benefits of this board too, right, is hopefully you'll only have to meet this one time or maybe one more time, because the new the new RFP process may look a little different for the process for reviewing costs and changing costs and things of that nature. But on the surface, the short answer to the question is I don't know if it would have any impact whatsoever on the RFP, because I don't know what the RFP looks like just yet.
Okay. And I'm probably going to call this incorrectly, and forgive me for this being way out of my field. Isn't there a Medicare index where a lot of services are based their rates on? How does your proposal compare to that index?
To Medicare?
And Mr. Van de Veit might be able to help me on the specific one or Mr. Parton.
Believe you're asking how do these rates compare percentage-wise to the Medicare rates
Yes.
currently?
Yeah.
Okay. Thank you. I would say, and I think our current Medicare rates, this is probably somewhere about, and this is just doing quick math, which I'm not good at, maybe 75% more than what current Medicare rates are, depending on the type of, maybe 150%. I don't know. I can tell you our average, or what Medicare rates are, kind of in general terms, are about $300 for an BLS call, $400 for an ALS emergency call, and roughly $8 a mile. So I guess that's kind of, I can certainly get that information for you. I'm happy to provide and take care of that, though, for sure.
Thank you.
Welcome.
And I guess what I heard Courtney say too is that I'm assuming that if all the performance indicators in the new contract were exactly the same, that these rates should carry. I mean, these rates should carry on. I mean, I don't expect that you're just kind of lowballing now and then, suddenly increase another. I mean, you do what you want to do in the RFP, but I wouldn't assume you'd have to come back and ask for another $500 rate if the performance indicator is the same. Now, I assume if the contract has some performance, issues that increase your level of work or service,
Sure.
in order to meet that, then you may have to come back and propose something. And, again, we're all held down in the healthcare industry by what Medicare and TennCare pays right now, and it's always usually about, somewhere around 40 or 50% of what we charge the insurance, what we charge commercial, but now commercial's kind of got us by the neck as well, because again, the whole issue of we can't balance bill. We can't do that. So.
Board members, any further questions for Mr. Spencer? Mr. Spencer, thank you.
Thank you.
Board members, I think I want to take the chair's prerogative here, and I think it's due diligence to at least offer the opportunity to have a public comment period for this board regarding this matter. So at this particular time, I will open the podium up for anyone in the audience that would like to come forward and make a comment. And by commission rules and otherwise county business rules, you'd have 3 minutes to offer a comment to this board. And that period's open now.
So I knew I chose him as chair for a reason, because he's done this before. He knows that stuff.
Mr. Chairman, I don't have a comment, but I would make a request of the body. And we actually could deal with this under other business if you prefer. But this body is a board or subcommittee of Knox County Commission, and as such, it is subject to the rules of Knox County Commission, including open meeting and sunshine laws. Most of you are going to be relatively familiar with those, but some of you very familiar with them, some of you less so. But Jessica Johnson from the Knox County Law Director's Office is here. And as a matter of due diligence, if the body would consider letting her give just an overview and some guidance to the committee, since the body is going to meet again. If I read the room correctly, there is some really vitally important guidance that she needs to share with you in between these meetings.
Most definitely. Please, sir. Welcome for her to come forward.
Good evening. I'm like the copyright warning on old VHSs. So I'm going to tell you what you can and can't do. So you are a public body. In Tennessee, that means your deliberations need to be public. And that means you don't talk to each other on the phone, don't email back and forth. Any deliberations that you do have to be in these meetings. Now, that doesn't mean that if you're at the grocery store and you see one another, you have to ignore each other, but all business related to this committee needs to be done here. In the same way, your communications about this topic are going to be public record. And just be aware of that as if you email or receive emails or anything like that. You can always contact me at jessica.johnson@knoxcounty.org if you have any questions about this, and I'm happy to answer any questions you might have right now.
Do you have a card, ma'am?
I believe I do. I will look and see if I've brought one.
Okay, please. And board members, any questions for Ms. Johnson?
I have one question. Ms. Johnson, if we do fall under, well, not if, We do fall under commission rules. Could we not, in between our formal meetings, have, say, a publicly noticed meeting? And if so, just a couple of us, if that were the case, and if so, who would we notice that through?
Yes, that is true. If you decide that you want to discuss this before your next scheduled meeting, even if it was just a subset of you all, you would need to publicly notice that. I assume Melinda or Kevin could arrange that. So yes, thank you for that clarification question. Anything else?
Yeah, what does publicly notice that mean? I'm not sure.
That means that we have to post a public notice that says that meeting will take place on this date, at this time, at this location. So that if anybody from the public wanted to come in, they would be able to observe that meeting. But you can't go, behind a closed door without any notice to the public and discuss these issues.
Is that a 15-day notice? Is that what that would fall under?
No, 48 hours. That's
48
right.
hours?
Yep. Mhm.
Okay. Board members, further questions for Ms. Johnson? Thank you, Ms. Johnson.
Thank you.
All right. Once again, is there any other members in the audience or anyone else that'd like to speak to the board? Seeing or hearing none, we will close the public comment period. And board members, we're down to other business. Is there any other business that needs to come before the board? And I think as far as the record, let the record show that we have maybe asked Miss Melinda there if she would gather those figures from Hamilton, Davidson, and Shelby counties if they're available. And board members, any other topics there of issues or anything that we need to have the health department work on for us before we meet again? Seeing or hearing none, once again, is there any other business that needs to come before the board?
Just set another date, I believe.
Yep, let's set another meeting date if that's possible, or if we would like to do that through the health department, we can do that as well to allow them to send out some dates there of potential like they did previously. I think that might be best.
If all of us need to be here, or at least a quorum would be 3 of the 5, correct?
Yeah, we would need at least 3 members for a quorum, yes, Dr. Dabbs, for sure.
I would recommend that, Mr. Chair, because the other variable in here is that Melinda has to confirm the availability of this room for purposes of your meeting.
Yep. And so I think as you did before, Ms. Melinda there, if you could just see what the room availability dates are and then maybe send us a list, and then let's see what works best for the board members. Is that?
Certainly.
Let me ask, Dwight, is there a time frame by which we need to have this decision? A week, a month, 2 months? Is there sooner the better, I'm sure, for everyone, but.
I do not believe there's one specified in the section of the code that authorized the creation of the body. I would say in all fairness to the present vendor, it did take a little bit of time for, in between the submission of the request and the composition and convening of this body. And then the contract itself actually terminates January 31st of 2024. Just for the general information of the body, Knox County does have Fitch and Associates under contract. This consulting firm to help us with the development of the next RFP. It's entirely possible that the next contract will look nothing like the current contract, and so whatever increase this body may or may not approve would be potentially relevant only through January 31st of 2024.
And if we approve these rates or don't approve them, or whatever, if we approve them, approve some change, is there a time frame of which those rates will go into effect?
I think that's at the discretion of this body, and I would point out that unlike many other subcommittees of commission, the sole authority for approval of these rates rests with this body. You do not actually make recommendations that go back to commission, I don't believe. I think you are the final authority on the decision.
Takes effect July 1st, whenever they approve it.
Mr. Cohen points out that it takes effect July 1st. I don't think he's wrong. There is a little bit of interesting history because if you read the section of the code that's relevant here in its entirety, you will see this body actually was supposed to have been convened years ago. But since there's never been a rate increase, the body's never been convened. So we are operating a little bit in unknown space here. But I think barring any disagreement, we'd probably concur with that. And if there was disagreement, we'd defer to the law director's office for their opinion.
Thank you, Mr. Van Vliet.
And one other question for us in terms of, if we voted now, to approve these rates, I suppose we didn't have this, or if we decided that we somehow could vote, do we have to vote together? Could we vote by email? Could we vote, how would we do that, Jessica? What would you recommend in terms of, the question is, do we need to all gather together again to make that vote, or can we?
No, you will need to come back together to make that vote. It's not something that can be done virtually or by email.
Okay.
Yeah.
So we do it now, or we got to wait to have another meeting, right? For sure.
Yes.
And another question. So the rate increase was request for such, for X, right? Suppose we approve the rate increase X minus something, or a different rate, a different than what's been requested. Is that an option for us?
I would have to look at the ordinance and the exact language, but I believe.
Would make sense, but.
Yeah, I believe, but I would need to read through the ordinance just to be 100% sure.
Can you research that before our next meeting?
Yes, I can.
Okay.
And I assume the way it will go is that we'll get some information, and I assume that information can be distributed to us before the next meeting.
Correct.
Because I'd like to have some time to digest that, what the other, so we kind of make apples to, may not be apples to apples, but it'd be apple to fruit. Maybe that'd be it. At least we can have some idea, and some of us can call. I mean, there may be, I've got friends who are, in the industry, and they do too, that we can get some idea about how you guys do that and what the rates are, and are we too low or too high, et cetera, and then be able to get that to the information to this body before we meet again. So hopefully, if we have one more meeting, we'll be able to come up with a decision that everybody can agree on.
Yes, and Melinda can send out information to you all in advance of the meeting for you to review.
Okay.
I think it is important that if there's any other information that we feel like we need, that we ask for it this evening and get that pointed to the health department there so they can find that out, board members, if there is anything else, for sure. And I'm certainly in agreement with Dr. Dabbs that I think that, as we move forward with this, we need to move, and hopefully there'll be some time here within the next couple to 3 weeks that we can reconvene, and we'll be watching for Miss Melinda there to send us some information.
Chairman, I'll certainly echo that we need to move as expeditiously as possible. And in answer to Dr. Dabbs and reading our charge here under our articles, we have a minimum of 60 days or a maximum of 60 days to act under this. So we have to do something within 60 days. Hopefully we will move much faster than 60 days, but it appears that we have 60 days to make a decision.
Yep, duly noted. Mr. Phillips? Board members, is there any other business once again come before the board?
I mean,
Mr. Van Dyke?
Mr. Chair, I'm about to forget the single most important thing I needed to say this evening, and that is on behalf of Knox County Mayor Glenn Jacobs, we thank all of you for your willingness to serve in this capacity.
Yeah.
thank you. I move we
Thank you.
adjourn.
We have a motion to adjourn. Is there a second?
Second.
We have a motion and a second to adjourn. All in favor, rise to your feet. Have a good evening, everyone. Be safe.